WFM 91.7.
A beautiful afternoon to you. Thank you so much for joining us this beautiful new week. Yes, I say it's beautiful because I'm definitely in that space where everything around me just feels good. Okay, so hopefully this week will be good and it will be great for you. All right, my name is Rose Yusuf Kaiser. You're tuned into Women Radio WFM 91.7, Nigeria's first radio station for women and their families. And you're welcome to the program, The Big Question. All right, The Big Question is a program where we profess solutions, all right, so, to issues affecting us as a nation. All right, we get to discuss these problems, and of course we prefer solutions to issues affecting us as a nation. All right, the big question comes to you Mondays, Wednesdays and Fridays at 12:05 p.m. All right, so do well to join the conversation by dialing 07000 917 917. Send us a text or a WhatsApp message to 070 All right, you can also follow us on all our social media platforms: Facebook, Instagram, Twitter, that's X, and of course YouTube at WFM917. Do well to log on to our website www.wfm917.com to listen live from any part of the world, or you can also download our mobile app WFM917. All right, and we will definitely be there for you to listen live to any of our programs you are interested in. All right, so well, today on The Big Question, we'll be looking at mental health. Now, tomorrow, which is the 10th day in the month of October, is World Mental Health Day. All right, but in commemoration of that, today we'll be looking at a very important topic when it comes to mental health, and we're looking at advocating for better policies on mental health in Nigeria. All right, that's our topic for today: advocating for better policies on mental health in Nigeria. And with me today on the program is a certified and licensed clinical psychologist. All right, so she'll be joining me on the program today. Now, she's not just that; she is a relationship, marital and sex therapist. Okay, and she offers comprehensive clinical assessment and psychotherapy for optimal mental well-being. So she's all round, if you ask me. All right, so I'm with Pamela Udoka on the program, certified and licensed clinical psychologist. Good afternoon, Pamela. Thank you for joining us today. Can you hear me? All right, kindly unmute your mic so we can hear you.
Oh, thank you very much. Sorry about that. The name is Pamela Udoka.
Udoka.
Not Udoka.
No, Udoka.
Okay. Even though I'm Igbo, and my husband is Akwa Ibom, so it's Udoka. Thank you for having me, Rose. I appreciate it.
All right. Thank you very much for coming in on the program this afternoon. So today, like I said, we're looking at an aspect of mental health in commemoration of the mental health tomorrow, which is the 10th of October, worldwide. So, now, World Mental Health Day is marked every year on 10th of October to raise awareness about mental health around the world. Now, this year's theme is Mental Health is a Universal Human Right. Now, mental health is a basic human right for all people. Now, the Nigerian law criminalizes suicide, abetting of the act, which makes it more likely to be hidden and underreported because of fear of prosecution. Now, there are also a myriad of mental health illnesses that people shy away from voicing or seeking help for because of the Nigerian society. All right, now the National Mental Health Act 2021 advocates a better quality of life and better quality mental health services for people with mental health condition. It addresses access to mental health care and the rights of people living with mental illnesses. All right, so that's why we are looking at advocating for better policies on mental health in Nigeria. Now, let's get on to it. Well, if you're just joining me, this is Women Radio, WFM 91.7, and this is the program The Big Question. And today we are looking at advocating for better mental health policies in Nigeria. Do want to be a part of the program by dialing 07000 917 917. Send us a text or a WhatsApp message to 070 317 56537. All right, Pamela. Now let me start by asking you, what are the major barriers to mental health care? Accessing mental health care in Nigeria. What are some of the barriers, when it comes to this?
Thank you so much, Rose. In line with the theme for this year's World Mental Health Day celebration, which is mental health is a universal human right.
Yeah.
So when you see it as a universal human right, and then you now have barriers to accessing this right, then there's an issue. In Nigeria, for instance, there are some barriers. One of them being funding, in terms of financing, accessing that care. Basically, most HMOs, all these health maintenance organizations, some of them don't have packages for mental health concerns of their clients or their patients. So you find out that some people cannot pay out of pocket to access mental health care. So that's a major barrier. And also some people are ignorant. They don't know where to go, to access mental health care. So they go to a general practitioner for mental health care. So apart from funding, there's just lack of awareness. And with the advent of social media, have a lot of quacks putting themselves out there as mental health practitioners. So people go to them to access care, and then they end up being worse than they originally were when they go to access care. Yes.
All right. Thank you very much, Pamela, for that. Now, do we have anything like crisis hotlines or support systems, to provide immediate assistance to those in need in Nigeria?
Yes, we do.
Okay.
We do, yes. I recall during COVID-19, the Lagos State chapter of NACP. So I'm a member of the Nigerian Association of Clinical Psychologists.
Okay.
We have chapters all over Nigeria, and the Lagos State chapter, we have hotlines that you can access, and then we can, in emergency situations, we can offer care, at least psychological first aid before you now approach the mental health facility, be it private or federal or government owned. So there are lines that people can access. Even in my own facility, there are lines you can call to access care. The people have to be aware that those such things exist.
Okay.
Yes.
So it's a problem of being aware that these things actually exist. That's what we're looking at.
Yes. Yes. We are trying to, pass on that information that they can access it. But some people want to abuse. They want to get everything for free, but it's just an emergency line, just for you to get some psychological first aid before you access proper care. Okay, it's not just for frivolous things to just make phone calls and to want to talk to anybody. No.
Okay. All right. Thank you so much, Pamela. This is Women Radio WFM 91.7, Nigeria's first radio station for women and their families. Now, this is the program, The Big Question. This is 14 minutes after 12. All right. And we are looking at advocating for better policies on mental health in Nigeria. And the theme for this year is mental health is a universal human right. So we're looking at, policies, how we can better these policies that people can actually access mental health care in Nigeria. All right, Pamela, now let's come down to how far has the awareness for mental health services gone? How serious do people take these things? Because Nigeria now, we are in a place where, sometimes when you say mental health, a lot of people just think, oh, okay, something is going on, something is wrong with you. But are we in that space where we see mental health as, as normal as having any other health issue or any other health condition? Are we in that space? Are we in that space right now as a country, or we're still
No, we are not, Rose. Sorry to say, even though steps are being taken in the right direction towards that state, for us to arrive at that stage, but we are not yet there. So let's not. Can you hear me?
Yes, I can. I'm with you.
Okay. So let's not discountenance the fact that a lot of work still needs to be done.
Okay.
And I want to place this directly on the steps of government, because if government takes it seriously, then the citizens will know it's a serious issue and they will take it seriously as well. As I speak, there's a mental health policy, but what we're looking for now is implementation. And also, the psychology bill is yet to be assented to. In fact, it's going to be represented, because the immediate past president did not sign. So it's going to be represented, and hopefully we'll have it signed this time around. Because the psychology bill will help the citizens a lot. Yes, because if you have a psychology bill, then the quacks I mentioned they're going to be out of the picture, and then the government will now create some level playing field for practitioners. When we say practitioner, we're talking about psychiatrists, we're talking about psychologists, we're talking clinical psychologists, talking about mental health, social workers, and psychiatric nurses and occupational therapists. Mental health is broad. It's not just one. We have a team. We don't just work as one arm. You understand? So the entire team has to come together. So that mental health policy and, of course, the psychology bill that will be signed will help us. Because if the government signs that, then we can now start talking confidently that we have the federal government backing. Some states are also very active, very proactive in this bill issue and mental health policy. Because it is then that we can now say, okay, let's create awareness. Let's take away the stigma. Let's when we talk about stigma, we're talking about the kind of language we use. How do you address somebody who is suffering from who has mental health issues? For instance, calling them mad people or insane people is wrong. Somebody who is suffering from mental health, very simply put, has an issue with the brain. And the brain is the part of the body. I'm trying to just simplify this. So I can have issue with my brain, I can have issue with my hand, I can have issue with some parts of my abdomen or my leg. So just because I'm going to an orthopedic hospital to treat any bone issue or broken bone, I shouldn't be stigmatized. So if I go to a psychiatric hospital or a private mental health care facility, I should not be stigmatized. It should be seen that, okay, I have this particular issue and I went to a professional to treat me. So when I come back, the language that is used to address me, the love that is shown to me, the support that is shown to me will help, in curbing the stigma that I will feel. And also, if my own stigma, if I feel supported, then I also want to share my story. I'm not talking generally, and people want to share their stories about what they went through and what they're experiencing now, how they feel better, to encourage others to acquire care, mental health care. So it is the government that has to pass that psychology bill that we're talking about, because it will sanitize a lot of issues in the country. Because if you don't give it that importance it deserves, then citizens will just be going around and around in circles without achieving a mental health state, and they won't be able to achieve their rights, their mental health rights, because it's a right. And then if we have policies in organizations where the owners of companies or the leaders of the organization have mental health policies in place for their organizations, then the staff know that whatever issues they are going through, they have support from the office. People will not lay them off because they have issues, because it can happen to anybody. It's not just for it does not look at your gender or your net worth or your tribe or your complete. No, it doesn't. Everybody can suffer from mental health. As long as you have a brain, you can have mental health issues. So if we normalize the conversation, and stop being judgmental, it will help a lot for us to arrive at that place that we want to be, that everybody's aware and everybody's mental health is a top priority. Because there's no health without mental health.
Sure.
We can talk about physical health, we can talk about emotional health, but the mental health is part of that whole when we're talking about somebody's health and well-being.
Thank you very much, Pamela. I like the fact you said, it's part of the whole being, like mental. You having issues with your brain, it's as good as you saying, oh, I have a headache, or one part of my arm is in pain, or I have an injury in my leg or something. So the more we talk about this and normalize it, then I think we'll get to a very great point of saying that mental health is as normal as anything. All right, thank you very
Yes.
much, Pamela. This is Women Radio WFM 91.7. My name is Rose Yusuf Kaiser, and this is the program The Big Question. And today on The Big Question, we are looking at the topic advocating for better policies on mental health in Nigeria. Now, tomorrow, which is the 10th of October, is the World Mental Health Day, where we get to we get to create awareness on the issues surrounding mental health. And today, we at WFM are looking at advocating for better policies, on mental health in Nigeria. And to do this with me today is a certified and licensed clinical psychologist, Pamela Udoka. All right, I hope I got this time. I got it right this time.
You did. I'm happy for you. Thank you.
All right, thank you so much, Pamela. All right, so do want to be a part of the program by dialing 07000 917 917. Send a text or a WhatsApp message to 070 317 56537. All right, Pamela. Now you touched on mental health policy. All right, so not so many Nigerians are aware that there's something like this. All right, you even talked about the psychology bill too. So tell us a little bit about that, and what we are expected to gain out of this if we have this implemented. All right, so what does it seek to address, and how is this going to bring a change in terms of mental health, care access in Nigeria?
Okay, let me speak about the psychology bill. When you have that psychology bill in place, it prevents non-professionals to offer services that they are not trained for. Because when you offer such services, you end up making the mental state of the person you're treating to be worse than how you met it, because you're not a professional. So that psychology bill will help the nation to weed out untrained professionals. That's why I insist, when you put my name, I say put licensed, certified and licensed. So if you are not licensed, you cannot practice. And we have a National Association of Clinical Psychologists, which incidentally, I'm the Welfare and Ceremonials Officer. So members of the association who don't have license cannot practice. In fact, you cannot even be admitted into that association without meeting some criteria. You understand? So when you meet, and then we also have regular trainings. We have a continuous education training workshop coming up later in the year, in November, first week in November in Ekiti State. So when you have such regular trainings, and you train your members and you keep renewing their license, then you will have qualified professionals. So that psychology bill will also emphasize that. Okay? Now, when that bill is passed, you find out that there will be a streamlining of caregiving by professionals alone. And then the awareness that is being created, government will now take it seriously that, okay, they have passed a bill, they have to support this bill. Okay, so we create awareness, the citizens to become more aware of such a bill. Then now the HMOs will have no choice. All of them will all have to include psychological services in their plan, which will benefit the citizens and those who access HMO plans. And also, because of that bill, it can also make professionals to say, okay, we will reduce our charges or offer such certain discounts to encourage more people to access professional care. Okay, so that awareness will be created. There will be a buzz all over for people to know that, okay, the psychology bill has been passed, and these benefits will be outlined, and everybody will know it. So that accession to that bill is of a matter of urgency. Okay, so we are appealing on behalf of the association and also the Nigerian Psychological Association, which is our parent association, for the government to assent to that bill, because lots of benefits will accrue to Nigerians when that bill is assented to.
Okay. All right. Thank you very much, Pamela. Now let's look at the government. Because earlier you mentioned how the government can do this, how the government can actually assent to the psychology bill and, get to implement it. And then we will actually see a change happening. Now, let's look at how the government can champion mental health awareness. All right. How can they emphasize that it's a fundamental human right? How? Because at the end of the day, sometimes once we have this enforced, even from the government, level, from the federal government to the state government, then you'll find private organizations, you find private individuals taking this seriously. So, how do we get the government to that point?
By having us on radio programs like this for one.
Sure.
Thank you. Yes, and having us go to the media, both print and social. I have over 20,000 followers. In fact, over 25,000 followers across social media. So this, your flyer, for instance, I spread across my social media platforms. My other colleagues who also have events both in the academia are also spreading such information in the social media. So we are creating the awareness through, and of course, government is not faceless. They are human beings who work for government. So they are reading this thing, and then when the submission for the bill is made, the people who are in charge have to realize that mental health is top priority. It's just because it's not written on the faces of people, there's no temperature to take that you say, okay, because it's not suffering from depression or has general anxiety disorder, so therefore the temperature must be this. No, the symptoms are observable symptoms. So because you cannot have symptoms that you say, okay, this one is suffering, it has high blood pressure or the temperature is high, does not mean that it's not important. So when those human beings who are supposed to implement these policies see that or realize that this is very important, then they will implement. It's not just having documents on paper that we're speaking about. It's implementing them. If you have to create awareness, if you have to get the Minister of Health, for instance, to liaise with, have a meeting or maybe a round table or square table discussion with the president of the Nigerian Association of Clinical Psychologists, the president of the Nigerian Psychological Association, and also the president of the Psychiatrists Association, and other arms of the members of the team I mentioned as forming the mental health team, having a discussion with them how we move this thing forward. So you can now see that everybody is on the same template, the same table. Yeah. We're on the same yes. So now, when they have this discussion at the national level and agree on certain things, and implementation, I emphasize implementation starts from the federal level. So all they now direct states to implement. They now states direct the local government, and then goes on to the councils. And then when they implement, all this is also be put in the education system. So you find out that there's something about mental health education from the primary schools to secondary to tertiary institutions. So people are aware of symptoms, simple symptoms that people can manifest either in themselves or they can observe in others, and say, okay, this person has this kind of issue. You are not a professional, but you have observed. You because of the awareness that you have heard about or you have seen, you can now say, okay, this person has this issue. Can I now point this person to the direction of professional help? Now, if, for instance, you're in primary school, where we have childhood depression, you notice that your mate is behaving funny, you can now report to your head teacher. The head teacher or the school counselor or the principal, or even in the university, maybe to your HOD or maybe to a lecturer. So those things can be escalated to the professionals. But if we don't have this implementation phases in place, we can't do that. I also hear about schools where children are being molested. When these children are rescued, what happens to them? Is there any psychological assessment and therapy sessions arranged for them? We're talking, this is Women Radio. We have women who have suffered sexual abuse, even rape. When we take them as survivors, what happens to them? Is it just, okay, sorry this happened to you? What is their mental state? What are we doing to them? What is the therapy that is planned for them. So when government sees that puts a policy in place and during implementation, you see that they can even release funds. Okay, this association, this is the funding we have for this. We have women who have been sexually abused and they need psychotherapy. Please handle them, because we can't work for free. We can only offer some charity services based on our personal conviction, but it's not enough. So if the government says this is funding for this, then we can say, okay, 50 women, 100 women come for assessment and group therapy. Then we know that we are implementing, we are assisting our citizens, you know. And you are, like what you said, you know, women and their families. Once you get the woman's mental health state right in the family, the family will do well. The family will stabilize. But when that woman is not stable, of course, it goes to show that the family will have issues. Not all of them will suffer from mental health, but of course, it will the woman's mental health states being poor will now affect certain things in the home. So that implementation has to be, as in fact, top priority. It's not just having documents on paper. Even when the bill is accepted, to which I believe it will be done, because we are creating a buzz around that and appealing for those who are in charge to please push it to the president to assent to the bill. But we have to implement. The government has to implement. The ministry has to implement, and then scale it down to states, local government, and the council areas, and to schools, the educational system.
All right. Thank you so much, Pamela, for giving us a breakdown of how this should go. Now, as we wrap this up, Pamela, how can we protect against mental health abuse? What can we do as individuals? What can we do as private organizations? Because you touched a little bit on organizations too earlier. So what can we all do as a society to protect against mental health abuse, whether for those who are, victims of this or not? How do we get to protect? We'll just wrap up with that with your final words, just in a few minutes, please.
Okay, I will answer that by giving you this brief story. I had a client, well, not a client, it was a charity offer ID. I was on radio like this, and somebody called me or sent me a message that if I respond to this message, then I'll be saving a life. So I called the number, and to cut a long story short, this guy had attempted suicide about 3 times.
Wow.
In one of the occasions, he jumped off Third Mainland Bridge. He was rescued and was taken to Ikoyi prison. That's another story.
Oh, wow.
But the issue is this. He said he would not have jumped if the person who was near him did not say, why they look the water? Jump now.
Ew.
Get that?
Yeah.
So that's when the person said that, he jumped. But if that person had said, what's wrong with you now? Come. I know the water. You are too close. Come out. And maybe give the person a hug. And then why are you standing so close to the water? I'm saying this to say that what we say to people matters. We don't know what people are going through. We don't know what is on their minds. Because when we talk about mental health, we're talking about people's minds. What is in their minds going on? What have they gone through that they cannot even tell anybody? Okay? So what you say matters. What you say to yourself matters. Because the way everybody goes through issues, goes through stuff in life, but how you handle your own situation, how you react to it, has implication for your mental health.
Sure. So
the way you react to that thing, the way you think about it, the way you feel about it, manifests in the way you behave. Okay? So now, when something happens, what do you say to yourself about that situation? One, what do you think about that situation? How do you think you can handle it? Are you keeping it to yourself? You keep suppressing, on one day you implode or explode. And then if you are working in an organization and you observe a colleague behaving funny in quotes, what do you say? What choice of words do you do? Are you quick to judge the people? Because I'm glad you mentioned I'm a relationship and marital conflict resolution expert. One of the things that will happen in the office, are things that couples or individuals bring from their homes, from their marriages. And if they manifest certain behavior in the office because of what they have gone through at home, how do you address, how do you talk to them? Do you judge them, or do you say, oh, thank God I'm single, I cannot have that kind of issue? Or, there's a way we talk to people. So what we say matters. We should watch our words, okay, and be more empathetic towards people. We shouldn't just throw words and be judgmental. Let's be kind with our words.
Yeah.
Everybody has a right to good mental health. But what we say to each other, what we say to ourselves matters a lot. And the government also has to not only put information or documents on paper, they also have to implement those items they have documented, so that the citizens will know that, yes, this government cares about us.
Yeah.
I mean, there's a statement now that are going around, people are going through a lot. It's obvious people are going through a lot, and it has implications for mental health. We are seeing more cases now of mental health than before.
Sure.
So if you do not take care of your significant others, nobody will do that for you, because it is you that you are close to them that will refer them for mental health care. And this does not mean that just anybody will just say, oh, this one, the person nowhere. No. You have to be tactful about it. Yes, you have to be loving about it. You are showing the person care. Don't push the person further down into the mental health abyss. No, it will not help. Let's all be kind to each other. Let's show love. It doesn't have to be financial. But what we say and the way we say it goes a long way.
There's power in the tongue. There's definitely power in the tongue. So you can actually make somebody happy, or you can send the person the other way. It's all up to you.
Exactly.
And it's a choice.
Exactly.
Funny enough, it's a choice. Thank you so much, Pamela. I wish you had more time to talk about this with you. Thank you so much.
You can always, just like you reach me, you can always reach me. I'm here.
All right.
And women will be. Yes, wonderful.
Thank you so much, Pamela. Thank you. Do have a blessed. I'm sure there are so many lined up activities for, people in your line of work for tomorrow, and, even as the days come by. So I wish you all the best.
After that, we all come together in what we call a family meeting in the NACP, the Nigerian Association of Clinical Psychologists, and discuss amongst ourselves, because we also need mental health care.
Of course.
We'll now discuss, on the 14th of October.
All right.
And just share what we have shared around the nation and amongst ourselves.
I wish you all the best.
So we serve each other better.
I wish you all the best. Totally all the best.
Thank you.
We're rooting for you all, for looking out for us.
Thank you so much.
All right. Do have a great day, and enjoy the rest of the week.
You too, Rose. Thank you so much. Thank you. Kudos to Men Radio. Thank you. Bye-bye.
You too. So there you have it. You have heard it from our guest today. Oh my goodness. I wish you had more time to be with her on the program today, so we can hear more on mental health. We need to be kind, if not for anything. At least let's take that back home, okay? We need to be kind with our words. Be kind in your actions to people. People are going through a lot. Even you yourself, you're going through a lot. So choose to be kind, okay? So thank you very much, Pamela Udoka, for being a part of our program today. She's a certified and licensed clinical psychologist, and today we talked on advocating for better policies on mental health in Nigeria. All right, so it's a collective effort to break mental health stigma and discrimination in various institutions of society, like schools, workplaces, religious houses, and so on. So we must work together and prioritize mental health as a fundamental aspect of well-being to support those living with mental health conditions in Nigeria, because mental health is a universal human right. A very big special thank you to our guest for today, Pamela Udoka, certified and licensed clinical psychologist, and to you also for being part of the big question. And a very big thank you to my sidekick Mariam, who did her own bits to make this program possible. And a very big thank you to the executive producer Tonwoke Wole Shunaya. Well, thank you so much for being part of the big question. Join us again on Wednesday, where we'll be talking about the International Day of the Girl Child. Yes, we'll have a lot in store for you on Wednesday. Do you want to stay with us? My name is Rose Yusuf Kaiser. Good afternoon.
WFM 91.7.